Look, kid. Bad things happen, and you can't do anything about it, right?
Right.
Wrong! When the world turns its back on you, you turn your back on the world.
Well, that's not what I was told.
Then maybe you need a new lesson. Repeat after me. Hakuna Matata.
What?
Hakuna Matata. It means no worries.
Repeat after me. Hakuna Matata.
Hakuna Matata. It means no worries.
feel good.
takes you higher, I will forever be intertwined with you. Where the sun never goes down and time has slowed down. Would it be too crazy if we decided to stay forever? Decided to forever. Stay forever. Stay, stay. Stay forever. Stay, stay. Stay forever. Stay, stay. Stay forever. Stay forever. Jump into the fire. I'd like to see your wild side. We should run away where the sun never goes down and time has slowed down. Would it be too crazy if we decided to stay forever? Decided to stay forever, forever. Stay forever. Stay, stay. Stay forever.
Baby, all I need one more chance. Oh, baby, let me show you. I need one more chance. Oh, baby, all I need one more chance. Oh, baby, let me show you. I need one more chance. Oh. All I need. Baby, all I need one more chance. Oh, baby, let me show you. I need one more chance. Oh, baby, all I need one more chance. Oh, baby, let me show you. I need one more chance. Oh. All I need.
Look at those palm trees dance. Look at those palm trees dance.
You gotta put your past behind you. Look, kid. Bad things happen, and you can't do anything about it, right?
Right.
Wrong! When the world turns its back on you, you turn your back on them.
Well, that's not what I was told.
Then maybe you need a new lesson. Repeat after me. Hakuna Matata.
What?
Hakuna Matata. It means no worries.
Repeat after me. Hakuna Matata.
Hakuna Matata. It means no worries.
Just wanna be alone with you. Just wanna be alone with you. Same old thing, the same old thing that keeps me around. And if you wanna come around, baby, it's cool. And if you wanna fuck around, baby, I do. Just wanna be alone with you. With you. With you. With you. Just wanna be alone. What was your name again? I've seen so many of them come. Want me just play pretend? All your girls, they just wanna have fun. But it's the same old thing that we all see. Same old thing that keeps me keen. But I just wanna be alone with you. Just wanna be alone with you. Same old thing, the same old thing that keeps me around. If you wanna come around, baby, it's cool. And if you wanna fuck around, baby, I do. Just wanna be alone with you. With you. With you. With you. Just wanna be alone.
بعيد الشر يا بلادي يا روح الروح يا البحرين، بنرخص كل شي لجلك يا أغلى من نظرها العين. يا أم اللي تربينا على حبها عمر وسنين، نفاخر باسمك ونكبر يا أغلى من نظرها العين. ترى عيالك على عهدك في ميدان الشرف باقين، تعبهم هان من أجلك تحت أمرك عسر أو لين. فديت ترابك الغالي مع بحرك وماي العين، يا عشق سطي في قلبي يا أحلى من الحلا والزين. تعلي وارتقي القمة بعزم رجالك الوافين، أبد ما همنا حاقد مدام بحب متحدين. تعالي وارتقي القمة بعزم رجالك الوافين، أبد ما همنا حاقد مدام بحب متحدين. بعيد الشر يا بلادي يا بلادي، يا روح الروح يا البحرين، بنرخص كل شي لجلك يا أغلى من نظرها العين. يا أم
لما نكون جاهزين اعطونا ان شاء الله.
يلا
منتظر الاشاره دكتوره. غيرت الواي فاي دكتوره؟ ايوه حيا الدكتور علاء ويعطيك العافيه، ومعلش نعتذر للحضور على التاخير بسبب المشاكل التقنيه. everyone seems to be on the internet. حيا الدكتور علاء ويعطيك العافيه، ومعلش نعتذر للحضور على التاخير بسبب المشاكل التقنيه. everyone seems to be on the internet. هاي دكتورة.
أهلا، كيف حالك؟
يا هلا، كيفك انت؟ اخبارك؟ يعطيك
الحمد
العافيه.
لله. هل الصوت الله يسعدك؟
الصوت ممتاز الحين عندك؟ انا الصوت ممتاز عندنا احنا.
لا، علي لي صوتك الله يسعدك شوية.
ايوه اوكي تمام، الصوت الان ممتاز.
تمام.
الله يعطيك العافيه. يعطيك العافيه دكتوره، واهلا وسهلا فيكي. طبعا غنية عن التعريف، اتوقع جميع الموجودين
موجودين معانا اوريدي متحمسين وصار لهم يكتبون انه يلا وين الدكتوره، نبغى نعرف كيف وي لوك يانجر واجمل.
الله يسعدكم يا رب. يعني شكرا على الاستضافه، وكل عام وانتم بخير، وكل عام ويعني كل المشاركين معنا في المؤتمر، وشكرا لكم وجهودكم، وان شاء الله تكون يعني من المؤتمرات اللي نتذكرها دائما عملناها فتره الكورونا.
امين يا رب بوجودكم ان شاء الله وجهودكم.
الله يخليك.
طيب دكتورة، أتوقع يعني ممكن أنت الآن تبتدي لنا. إحنا طبعا محورنا واضح، لكن لو حابة ممكن we use 5 minutes تعطينا بس a glimpse أو يعني رأيك مثلا how did Corona change the way you do fillers or botox أو how you do aesthetic, did it change anything صار في أي تغيرات؟ أعطينا يعني شوية إنسايت كذا خفيف 5 دقائق قبل لا نبتدي الجد في المحاضرة.
تمام. طبعا دكتور، نحن من قبل الكورونا لازم نحفظ نفسنا، لأن هي الكورونا it's not the only virus, it's what's new about it is new for us. ما عندنا مناعة عليها، ما عندنا مناعة وما عندنا فاكسين، لكن الميكروبات والفيروسات يعني أغلط وعد موجودة أوريدي. فنحن أوريدي عاملين احتياطاتنا في مجال التجميل إنه نمنع أي احتمالية التهاب سايرة. فنحن من زمان أخذنا الاحتياطات كلها في الحقن، خصوصا انه نحن بيصير في دايركت فيري كلوز كونتاكت، يعني الدكتور بيقرب من البرايفت يعني سبيس حق المراجع عشان يحقنوا بالفيلر او البوتوكس. طيب طبعا هذه ليها شروط معينه. يعني انا مثلا من زمان كنت من الناس اللي افضل اني انا احقن المراجع وانا لابسه ماسك. ليه؟ لانه كنت فكرتي زمان اني انا ما ازعجه. طيب انه نفسي ما يجي على نفسه وما يتضايق، مثلا ريحه نفس ما يتضايق، هذه الاشياء كانت انا يعني بالنسبه لي مهمه. فسبحان الله دحين جاء وقتها. طيب فمن الاشياء اللي بنعملها دحين
العمليات صارت اساسيات.
بالضبط، هو هذا. طبعا عندنا في العياده حاطين ستيشن خاصه قبل ما اي احد يدخل سواء من الاطباء او المراجعين لازم يفحص درجه الحراره. لو كانت اكثر من 38 لازم نبلغ وزاره الصحه. بعد كده في مواعيد مخصصه ما بين كل مراجع ومراجع عشان ما يكون في تكدس. طبعا العياده كلها عملنا يعني متر ونص بين كل مراجع في الانتظار، ساحه الانتظار او الريسبشن. في غرفة الحقن نفسها شلنا كل الكراسي عشان ما يكون غير في مراجع واحد فقط. ممنوع المرافقين، ممنوع كبار السن، الحوامل، الأطفال كلهم ممنوعين. طبعا لازم أغير الجاون حقي ما بين كل مريض ومريض. الجلافز هذا شيء أكيد إني أنا أغيره، ما أخرج برا العيادة وأنا لابسة الجلافز. طبعا it is personalized with each patient. نلبس الماسك ونغيره طبعا ما بين كل مريض ومريض. يعني هي هذه الإجراءات. يمكن الإجراءات الخارجية إنه نتأكد إنه عندهم درجة الحرارة، هذا الجديد علينا، لكن نحن كنا بنعمل تقريبا نفس الأشياء هذه ما عدا الجاون كمان داخل العيادة.
صحيح. الله يعطيكم العافية، ويعني ودائما حضرتك ما شاء الله عليك on the spot و on the latest update وtrends. لو تحبي دكتورة ممكن نبتدي بمحاضرتنا لليوم.
طيب.
Shall I ask you? I think Nick, we can start the slides, please.
Okay. طيب, my lecture today will be about rejuvenation and beautification of the upper part of the face. طيب, we all concentrate. Usually, we have an idea that if we concentrate at the mid third of the face, we can affect the upper part and the lower part. Because affecting the mid part of the face, we can يعني cover the area under the eye, the tear trough, and we can also pull upwards the nasolabial fold and even the jawline and the sad mouth. لكن في هذا كله نحن بننسى الأبر فيس. طيب الأبر فيس ليه إمباكت كبير على البيشنتس. طيب وجدا مهم. Let's see the slide please.
Okay, slides on دكتورة. أنت هل تؤيدي نظرية إنه الأبر فيس والميد فيس مرتبطين ببعض ولا you can actually تفضل.
مرتبطين. بعدين على فكرة دكتور خلينا نشوف السلايد اللي جاية.
يلا تفضل. slides are on.
طيب next one. Yes. طيب this slide or the upper part of the face belongs to one person. طيب in different stages in her life. طيب ممكن نقول مين هذه دكتور؟ عندك فكرة مين هذه؟
والله ألين واحدة منهم. ألين واحدة منهم ألين، بس ما أعرف اللي في النص ولا اللي على اليمين.
كلهم ألين لكن in different stages in her life. فنحن من ال upper part of the face, from the hairstyle, from the eyebrows, we can locate, we can يعني personalize the person. That means that the upper part of the face is very important. Let's see the other slide.
Next slide, كرم.
طيب what about this person?
الباتشينو.
الباتشينو أكيد. طيب حتى التايب اوف wrinkles، حتى شعره، كثافة شعره، حتى الايبراوز كلها specialized. That means that the upper part of the face is very important. وباي ذا واي يمكن نحن يا دكتور لو تقدر تشوف السلايد الأولى لما كان صغير والسلايد الثاني لما كان كبير، نقدر نحدده أكثر لما كان كبير. لأنه لما كان كبير، لما يصير كبير الإنسان حتى الواي اوف aging تصير personalized ليه. Okay, but this is very important point. عشان كده نحن we cannot put one plan for all the people.
ممكن دكتورة شوي توضحي كيف يعني تكون personalized for him؟ قصدك الطريقة اللي he use his muscles, strength in some
طبعا
part.
الطريقة اللي he use his muscles, his lifestyle, his genetics. طيب his type of skin color. طيب كلها we age differently in different ways. فنحن the more we age differently the more we become more specific to our look. يعني you can locate me لما كنت كبيرة أكثر لما أكون صغيرة. لما أكون صغيرة ما يكون عندي ال wrinkles، ما يكون عندي الفيتشرز حقتي تبان أكثر مركزة.
اوكي دكتورة لو سمحتي بس وتحاولي تكوني في وسط الصورة شوي على اساس نشوفك كاملا. ايه ولو عندك دكتورة لو حضرتك بتشوفي السيمينار من اي براوزر او لابتوب ثاني، خلي الصوت في البراوزر الثاني يكون ميوت على اساس ما يصير صدى.
في صدى عندكم؟
في شوية صدى بس it's fine. بس if we just can mute the other browser يعني انت خليكي بس بتكلميني وبتسمعي صوتك وصوتي من خلال السكايب. And I think we have a couple of people who don't speak Arabic and they were a bit upset that we left them outside. So we'll try our level best to speak in English inshallah.
Okay, so let's see the next slide please.
Next slide.
طيب the next slide, as we see here, most of the patients they come for us looking for facelifting or rejuvenation of the lips. Doctor, I wanna raise my cheeks or I wanna fill my lips. But nobody think about the upper part of the face. So this is our responsibility to try to manage it and try to evaluate it and make the patient to take care of it and notice it, because a lot of people they don't notice that the problem in their face it is in the upper part of the face. Let's take the other picture please. Other slide. Yeah. As we see here, we have something called Picasso faces. That means that the different part of the face, I mean the different thirds of the face, the upper, the mid, and the lower third of the face, they don't comprehend with each other, or they don't mix with each other. As we see here, the lower part of the face, in the first picture where there is the arrow, the chin retruded. طيب, and this make the lower part of the face doesn't fit the upper part of the face. What we call Picasso. And as we see in the second picture, the middle-aged lady, we see that there is problem with her temples. On the other hand, we can see that her cheeks are thin and nice. And that causes Picasso face, and we can fix this problem by injecting the temples, and it will harmonize her face. And the last one, the baby, we can see how he have big cheeks comparing to his other part of the face. Okay. So
في عندنا مشكلة زادت حضرتك حاليا. انت which mic you are using?
اللابتوب and I'm using only the laptop.
في هيدسيت مركبة اي شيء؟ في ايكو عالي جدا.
لا خليني اشوف. طب اشيل الاشياء دقيقة.
خذها. ايه لأنه فجأة كل الحضور بيتكلموا عن الإيكو. أنت محمد الآيباد كيف صوت؟
طيب كده الصوت واضح؟
أعطينا بس في ديلي يكون 10 seconds فثواني.
أوكي.
الآن we'll test it.
أوكي.
لأنه ما شاء الله الكل قاعد يقول لا خلي الدكتورة تعيد، خلي الدكتورة يعيد. كيف الصوت محمد؟ محمد كيف الصوت؟ كيف الصوت الآن؟ كيف الصوت؟
الصوت واضح؟
أعتقد يس، أعتقد الصوت ممتاز الآن.
everybody كيف الصوت؟ واضح الصوت؟
الصوت وين عندكم؟ عندي أنا؟ فيني هيدسет. ما عندي. صوت الدكتورة صار أوكي؟
صوت فاين؟ أوكي.
طب دكتورة، هل عندك مانع لو نبتدي السلايدات من الأول؟ لأنه أعتقد هي رغبة الجميع. هم all 2-3 slides. Could I start slides all over please from the beginning? From slide number 1.
Okay.
تفضل دكتورة. Yeah.
Welcome everybody. Sorry for the lack and sorry for being unclear before. Let's talk again, and I'm going to start. Today I'm going to talk about the upper part of the face, which is usually neglected, although it is very important. I will show you how important is it. Let's take the second slide, please.
Next slide.
Okay, these 3 slides belong to one person in different stages in her face. Can we locate who is she? From the hairstyle, eyebrows, the upper part of the face shape. Can we locate who is she?
Yes, she is Ellen.
Ellen DeGeneres, exactly. That means that we can locate and personalize the person from the upper part of the face by itself alone. Let's move to the other one.
Okay, next slide, Karam.
Next slide. Okay, next slide. Also, it belongs to one of the famous people in different stages in his life. Al Pacino. Okay, as we noticed here, that it is more easy for us to notice him in the picture where he is older than the one he is younger. Because when we get older, we become more personalized with our features. And the way we get aging, usually it differs. That because different reason, because of genetics, because of our lifestyle, because of different movement of the muscles, because of how we take care of our skin, and if we do some aesthetic procedures or not. Okay, let's move to that. Sorry.
Next slide, Karam.
Next slide, yeah. Usually the patient come for me asking for facelifting or lifting the cheeks or injecting the lips. But usually they neglect the upper part of the face. And this is one reason. The other reason that it is off-line procedure, off-label procedure. Okay, that's why we only few of the companies, they afford some training and they highlight this problem. Rejuvenating of the upper part of the face.
Jamil.
Take the next slide.
Next slide.
Okay.
Karam, you can paint the book.
Okay, there is something called Picasso face. What does it mean, Picasso face? Picasso face means that there is no harmony between different parts of the face. Like if we divide the face into 3/3, upper, middle, and lower, there is no harmony between them. We can see like if there is a well-developed upper part of the face, and there is beside it lower part of the face which is like retruded chin, it will give us Picasso face. Sometimes genetics, sometimes we create it by ourselves. Let's go to the mid-aged lady in the middle. We can see that she have good face, but she have retruded temples, and it shows. Let's go back.
Go back. Don't move the side, please. Yeah.
And it shows how depressed temples can affect even the shape of the cheeks. It shows that they are filled, overfilled, although they are normal. Okay, let's go to the next slide. When we talk about the upper part of the face, we are talking about 3 areas: the forehead, the eyebrows, and the temple, and the glabella. Okay, they are all considered to be one unit. I will talk about
one aesthetic unit. No.
Yeah, aesthetic unit. I will talk about the forehead, eyebrows, and the temple. I will not talk about the glabella because this is one of the dangerous zone. It needs a separate lecture by itself. So let's go to the areas that are easier to manage now, and the glabella, it needs by itself a separate lecture.
Sure.
Okay, let's
next
go to
slide.
the slide. Okay, when we evaluate the upper part of the face, we start with the shape of the hairline. The shape of the hairline, it has been said that it can even determine your personality. And it is obviously, from our aesthetic point of view, it can determine the shape of the face and the forehead. Let's go to the next. Can you press next? No, in the same slide. Can you press next? No, the upper one. Yes? Can you press again? Again, please, can you press here? At the same slide, yes. Because we can, there are different...
Yes, there are different... One moment.
Yes. Different shapes in it, yes, again. Again, yes, can you see here? They are all for the same picture of the lady, but with different shapes of the hairline. Okay? Okay, let's go to the next slide. As we can see here, there is a big difference between the male and the female pattern of the frontal hairline. In the male, we have usually the M pattern, while in the female, we have the inverted U pattern. But always, the woman can also have the M pattern when she have androgenetic alopecia. Let's go to the next slide. We can see here Kim Kardashian. She decided to do laser hair removal in her frontal hairline just only to change the shape of her face. So one of the aids or one of the procedure we can use the hair removal laser is to change the frontal line shape. Let's go to the next slide. Okay, next one. Now we are talking about beauty standards of the forehead. Okay, so to measure the standards of the beauty of the upper part of the face, the length of the the forehead should be equal to the length of the nose, should be equal to the length from the end of the nose to the lower part of the chin. Okay, and the width of the forehead should be equal to the width of the cheeks. The most maximum transverse line in the cheeks. Okay, so again, the length of the forehead should be equal to the length of the nose, should be equal to the length of the point from the lower part of the nose to the chin. And the width of the forehead should be equal to the width of the chin. Okay, there is a very important angle which is always best in the face, which is called the glabellar angle. It is the maximum projection of the eyebrows. We call it the glabellar angle, and usually it is more prominent in males. It is very important to decide the beauty of our profile and how the curve of the face. We will see now in front, in the next slide. Is everything clear, Doctor?
Yes, أنا للأسف دكتورة طبعا I wanted to stay with you and interact more, but still people are complaining about the echoing with my mic. فذاتس why I switched it off على أساس أحاول أخلي صوتك واضح قدر المستطاع. But I will be with you on and off, but I'm with you. Next slide, do you see it now? Is it showing?
Yes, but Doctor, what's the point if there is nobody's hearing me?
لا they're hearing you, بس أنا بطفي مايكي على أساس ما أسوي echoing على حضرتك بس.
So people can hear.
Yes, everyone's hearing you clearly. But when I switch my mic off, it's becoming clearer. But that's why.
Okay.
Yes.
So can you press in this slide, please? I want to show them something. Okay. The shape of the forehead can determine the shape of the profile. Can you press, please? Double click. Okay. So if we have here a projection forward of the forehead, the face, can you press again, please? Can you press again? Yes. If the forehead is projected anteriorly, that means that the profile is more into convex. While if the curve of the forehead is going inward and the glabellar angle is very open and there is anterior projection of the chin, that means that the face is concave. While if there is the same level of the chin and the glabellar angle, that means that the face is more in harmony and it is a straight forehead. Next slide, please. Okay, we can see the difference between a male and a female forehead. Usually the male have more bony structure and it has like more temporal ridges which give them the masculine and the strong features. Next slide, please. We can see here, if we look to the orbital ridge, we can see they are well developed in male than in female. Okay, but in female, we can see the forehead, it is more slopey, it is more softer, and which give it the feminine touch. Now, next slide, please. There is a study that shows that the forehead have 5 defects. The first one, there is a diamond shape depression between the eyebrows, okay, and this is the most common type and usually very easy to be filled by filler. The next one, please. The next one, can you press next slide, please? Yes, the next one, there is double triangle over the eyebrows, okay, and also there is easier way to fill it with fillers. The third type, there is a mix between the first type and the third type. There is like a transverse depression line above the eyebrows. The fourth one, please. The fourth, next slide. Okay, there is a huge depression in the mid of the forehead, and this is the most frequent type, with the smaller one, which is the diamond shape one. We only fill it with fillers, and this is one of the easy procedures, but we have to take care of the structures and the blood vessels in this area. The last one. The last one, back. Yes, the last one, there is a depression at the superior part of the forehead. And this will give me an anterior projection of the glabellar angle, which will be exaggerated. Okay, so these are the 5 types of the forehead defects, which we have to evaluate them. And then after that, we have to deal with them and fill them with fillers. So now let's move to the eyebrows. Next, we can know how the emotional state of any person by only looking to his eyebrows. If he is happy, he is sad, he is surprised, he is shy, we can know it by his eyebrows, so it's very important. And we can divide the anatomy of the eyebrows to, can we see the next slide, please? To the head, body, and tail. Okay, and the action and the movement of the eyebrows is subjected and controlled by 4 muscles. Can we see the next slide, please? There is only one muscle that is pulling the eyebrows upward, which is the frontalis muscle. Okay, but there are, on the other hand, 3 other muscles which are depressing the eyebrows downward, which are the corrugator, procerus, and orbicularis oculi. And we have to manage the harmony between these muscles when we do the Botox in order not to change the movement or the shape of the eyebrows. Next, please. Okay, we have to know that the eyebrows of the male should be horizontal, while the eyebrows in the female should be going upward with a little bit of slopiness upward and then going downward. So 2/3 will be in a direction of upward going laterally, and then the last third will go downward. So we have to make sure that we do the Botox for the male. It is different than the female because we don't want to feminize the male eyebrows by lifting the eyebrows upward, and it should be always horizontal. This is a very important point when we inject the Botox. Okay, next.
دكتورة معلش مو فقرة الأسئلة بس على السريع how can we align between this yet avoid the manifesto sign, which is the very high upwarded eyebrow?
Okay, we have to inject in specific points, Dr. Muhammad. Okay, there are specific points in the female. When we inject, we have to raise the lateral 1/3 of the eyebrows by injecting in the eyebrows in the in the 2/3 point and the last point. But the Botox and Botox drops here. So we make the muscles weak and then we raise the eyebrows. Okay, but we have to do it like 2 2 cc at each point. If we increase the dose, or sometimes because the muscles are very weak, it will give us mephistoline. We have to treat mephistoline by injecting Botox in the frontalis. It will be like injecting above the 2/3 point, okay, 2 centimeters above it in the frontalis muscle. Is it clear ولا لا؟ يا ريت كان عندي can you see here؟
لا هي كلير وبالعكس لا ممتازة. للعلم دكتورة احنا ارسلنا لحضرتك a couple of questions up to you. تحبي نجمعهم للآخر ولا تحبي ناخذهم as we go؟
ممكن تسألني دكتور اسمعني، باقي 3 سلايدات وناخذ أسئلة وبعدين ناخذ المحاضرة الثانية، ايش رأيك؟
ايه perfect.
اوكي طيب ناخذ next slide please. The temple area. The temple area, it is a 3-dimensional area. It is the area between the frontal hairline, eyebrows, and the zygomatic arch. It is very important area, and it can be affected by 3 main reasons. Let's see the reasons. The next slide, please. Okay, it can be genetically, or it can be affected by weight loss or aging. Usually, when I see a girl, young girl, have depressed temple area, the first thing usually come in my mind that she did a bariatric or weight loss surgery, because usually it affects people who lose weight in a short period of time, a large amount of weight. And I think it's one of the stigma. That's why people come and fill this area in order not to show, because it reflects how much they are tired. Okay, let's take the next step. So what are the aging signs of the upper face? They are bony remodeling, ptosis of the eyebrows and eyelids, and fat prolapse and atrophy, which will lead to heaviness of the upper eyebrows as well, and temporal hollowing, and periorbital hollowing as well, and skin laxity, thinning, and pigmentations. Let's see our last slide in this lecture. So, if we want to treat this problem, we have to divide into 3 or 4 layers of the skin. The subcutaneous layer, which are the epidermis and dermis, and usually we treat them by laser resurfacing and skin tightening devices like Althera, Ultraformal, radiofrequency. We can apply some peeling to remove some of the aging sign pigmentation. While if we want to go deeper, we can treat the subcutaneous fat, muscles, and bone by toxins and filler. We fill the hollow areas, and we can enhance the tone of the muscle by applying toxin, and weaken some of the muscles. We need to use them to raise the eyebrows. So here we come to the end of our beauty standard of the upper part of the face, and we will take some questions now.
يعطيك ألف عافية دكتورة، المحاضرة جدا جميلة عندي العديد من التعليقات قد هم مستمتعين، وأنا ما لي علاقة دكتورة، بس في مطالبات ويبغون محاضرات يعني أخرى أيضا، فهي طلب الجمهور مو طلبي أنا.
الله يخليك إن شاء الله.
طيب السؤال الأول عندنا يقول how you can treat the patient after complication in case of full eyelid ptosis after wrong Botox injection.
Okay, usually I have to reassure the patient and tell him or tell her that it will be only for a transient transient amount of time, and it will fade by itself. But if somebody has very important event or it's exaggerated, we can use Alpha-GAN eye drops in order to remove the effect of the Botox in the muscles surrounding the eyes and remove the effect of the ptosis. Usually I have to avoid this complication before it happens by applying the correct amount of doses of Botox, because some people, especially the old people, they have weak muscle. So any tiny drop of Botox, it will evict them, exaggerating for the muscle. And so we should be very cautious with them, and we have to put in the appropriate areas. And also, if people who are very new to inject Botox, we have to highlight and mark the areas we should inject in them. And the last thing, we should ask the patient not to do exercise or bend for prayer after 3 hours after injecting the Botox, in order to make sure there is no possibility of merging of the Botox to nearby muscles that we don't want it to affect the other muscles that we don't want it to be affected.
طبعا دكتورة and correct me, whatever eye drops اللي هي we will use it to correct the effect of Botox, we have to tell them that it will not resolve the issue 100% because usually it will take some time, but definitely it will make things better. It's طبعا applied typically around the eye.
It will apply as eye drops.
Okay, as eye drops.
Make sure that the person doesn't have any medical eye issue, because it can affect the blood pressure of the eye. Okay. So we should make sure that they are clear of any ophthalmic
glaucoma, cataract,
exactly, and we should tell them that it will not solve the problem in one day. It will only make it stay for lesser period of time.
جميل. Okay, يعطيك العافية. Next question, the revolution of Botox and filler in aesthetic. هاي مؤلفات وكتب أتوقع السؤال هذا. ما أدري إذا عندك تعليق على هالسؤال يعني. اسمعيني دكتورة؟ ألو دكتورة؟ دكتورة تسمعيني؟ There is a sudden تسمعيني دكتورة؟ دكتورة معانا دكتورة؟ أعتقد في مشكلة في الكونكشن في الإنترنت. Nothing. I can't hear the doctor. I'm sending to her on WhatsApp. خلاص خلي عندها عشان لا تلخبطها. دكتورة؟ دكتورة ما أسمعك يا دكتورة، ما نسمعك. She's disconnected. خلينا أشرح. قفل. جماعة عندنا مشكلة في الكونكشن مع الدكتورة، راح نحطكم على بريك لدقائق وراح نرجع لكم على بين ما نحل المشكلة مع الدكتورة.
بعيد الشر يا بلادي يا روح الروح يا البحرين، بنرخص كل شي لجلج يا أغلى من نظرها العين، يا أم اللي تربينا على حبها عمر وسنين، نفاخر باسمك ونكبر يا أغلى من نظرها العين، ترى عيالك على عهدك في ميدان الشرف باقين.
دكتورة يعطيك العافية. يا هلا.
الله يعافيك.
يعني يعطيك العافية، الجمهور جدا متحمس، وأنا يعني للأسف عندنا شوية مشاكل تقنية لكن ما عليه، الأمور طيبة.
سنستمر نغم الظروف كورونا.
أنا أشوف we can continue and we can do another episode نعطي فيها حتى نفس الليكتشر in depth على راحتك. How do you feel؟ أنت حاسة إنك تعبانة أو أعصابك مشدودة؟
دكتور في other question now. صوتي واضح؟
صوتك واضح جدا، وفي كمان في شوية أسئلة، بس if you feel we are late we can carry on الآن مع السلايد البرزنتيشن الثاني ونجمع الأسئلة كامل في الآخر.
ناخذ few questions.
ناخذ few questions. No, we'll continue with some questions. So, are we ready to go back on live? When we'll be back? Tell me when we are back on live. Okay, احنا لايف مرة ثانية دكتورة. يعطيك الف عافيه. قفل اللابتوب ها يا دكتوره، يعطيك العافيه.
الله يعافيك.
طيب دكتوره، عندنا ايضا يعني كنت اخر السؤال الثاني اللي كان موجود عندنا وانقطع، احد من المشاهدين كان يسال الدكاتره يقول the revolution of botox and filler and aesthetic. طبعا I think it's a big topic، ممكن نخصص لحضرتك محاضره كامله تتكلم حتى عن التاريخ تبعها والبايوكيمستري والكيمستري، بس ما اعتقد مكانها اليوم في محاضرتنا. سؤال ثاني، how it is considered a defect wouldn't it be a variation of anatomy؟ أتوقع كانوا يتكلموا عن الديفكتس اللي موجودة في upper part of the upper third of the face.
There is beauty standard, okay? There is sometimes we want to take we want the face to be in harmony with each part of it. طيب, that's why we make some measurement for the طبعا نحن we should put in mind that there are different genetics, different backgrounds, different shapes. لكن يعني the average it should follow these beauty standards, and they are very easy and very simple as usually to most of us. طيب, because it make the face look more comfortable when we look to it. لكن it doesn't mean that there are some exception and some beautiful exception. I avoid to say I hate and I avoid to say that this face is not following the beauty standard, because all the faces are beautiful by its way. لكن for us as aesthetic doctors, we have to have some standards to follow that it will make the face look more comfortable and in harmony with each other. This is the whole idea about it.
يعطيك الف عافيه دكتوره. عندنا تعليق you are so amazing doctor, thank you so much and God bless you. وعندنا تعليق ثاني ايضا برضو you are amazing doctor. اخر سؤالين هم related to each other فراح اجمعهم انا في سؤال واحد. Is there any facial exercise or massage which can maintain the health of the upper part of the face? والother question اللي هو related, what does cause dropping of the eyelids يقصدون ptosis, and how can we avoid it?
طيب, for the first question, any massage, I don't think there is a study that shows that there are a strong effect of the massaging the muscles with it will do a rejuvenating effect. But all the yoga people, exercise people, beautification people will say that it has some sort of effect. But for me as a doctor, I don't rely on these exercise or these massages in order to enhance the activity of the muscle, because I have something stronger in my hand, which is the Botox and the filler. The other question, how can we treat the ptosis of the eyebrows? We can treat it either surgically or non-surgically. Surgically, it is done by the plastic surgeon. They do sort of like surgery. They take part of the skin, extra skin, and try to link it with each other in order to remove the eyebrows. Okay, but for me as a non-surgical aesthetic doctor, usually I use the Botox to remove the eyebrows, to use the filler sometimes in order to give us the anterior projection in case people have some remodeling of the bone and it becomes flat. It will give them some like fresh look. And some people use the ultra-formal laser device, and other people use what we say the threads. But it depends on how much we have the ptosis, what is the state of the skin, and sometimes we can use the surgical and we can use many options of the non-surgical with each other.
طيب, يعطيك العافية دكتورة. We will put on the slides of the next lecture.
Okay.
And نبتدي مع حضرتك segment 2. Yes, we're ready. Please, can we move on? Okay, Dr.
We will go to the practical part of rejuvenating the upper part of the face. Let's go to the next slide. As we say that it is very difficult to convince the patient to enhance or inject and spend some thousands of reals in only beautifying areas in their face that they cannot even evaluate or notice. That's why we have to show them some pictures before and afters. We have to explain to them, we have to educate them. And the other thing that doctors, not most of them, some of them, they are reluctant to inject this area because it is off-label. And most of the filler and Botox company, they don't provide training in these areas. But although it is very important, we have to know how to deal with them in a safe way. So let's go to the forehead practical part. Next slide, please. The next. Okay, what is the anatomy of the forehead? There are three important borders. Inferiorly, we have the nasal roof and the eyebrows and the glabellar area. Superiorly, we have the frontal line. And laterally, in both sides, we have the temporal lines. This is the forehead. Next, in this area, we have 5 layers. This is very important. We should know our anatomy. It is the skin, connective tissue, loose areolar tissue, frontalis, the muscle, and pericranium. Okay, and usually the blood vessels, that is very important in this area. We have two, the supratrochlear artery and the supraorbital artery. They are very important, and the most important part when we inject this area, we have to avoid them. So when we inject, next slide please. The type of filler we are going to inject, it is cross-linked, either low to mid density by deep microdroplets or superficial threading and fanning by cannula. So we have 2 ways to inject this area, either by needle droplet down to the bone or superficial threading and fanning by the cannula. Let's see the next video, doctor, or next see the other slide. This one of the patients who came to me, presented to me. If we can evaluate in her profile, the forehead, we can see there is a slight depression. Really, for me, I cannot notice it that much, but she came specifically to treat this area. It was bothering her. Let's see in the video how did we deal with this patient. Twarina, can we see the video, please? Can we double click? Yes. I'm using Volbella, which is low density hyaluronic acid. I'm trying to fan. My entry point, it was in the supraorbital ridge because I wanted to avoid the blood vessels in this area, the supratrochlear and the supra artery. And I will do the same thing from the other side, and then I have to massage it. Usually what is bothering for patient that when they go home after the first day, it will not be flat. They have to massage it. And usually I reassure them. I tell them, listen, it will not look very pleasant on the first day because you will see some bumps because we have very thin layer between the skin and the muscle. So the bumps will be easily noticed. But I have to reassure them because after that it will become flat, and with the result will increase the beauty of the result in a couple of days. Let's see the next slide.
طبعا دكتورة, I was laughing because our IT technician on the big screen, he suddenly saw this video of needles and he have a phobia of needles. So يعني, he was just about to faint. Next slide, please.
Okay, let's see. Let's see here the before and after. The picture where with the arrow, this is the before, and the after, it is the one without the arrow. We can see how the anterior projection, it is very nice. It gives her more feminine look because the more it is slightly projected anteriorly, this is feminine touch. But if it's like slopey or it is straightforward, it is a masculine feature. Let's see another example. The next slide, please. This is one of my 12. We used here only 1 cc of Volbella. I injected half from each side and I went medially by fanning in the needle. Let's see the next one. The next slide. This is for the same patient. As you see here, the after picture, the profile, it doesn't seem very beautiful. There is a lot of bumps. This is fine and normal. We have to assure our patients. Okay, because it will absorb more water and it will spread and it will take its shape later after a couple of days. Let's see the next one.
Doctora, a lot of I see a lot of people asking us to play the video again with explanation لو تعيدي مرة ثانية لهم. Do you want to do it at the end ولا shall we do it now? What do you like?
Let's do it now because we can move to different points.
Okay, sure. Let's go back please to the video and play it again.
Here, I decided to inject my patient by 2 cc, okay, of Volbella, which is low density cross-linked hyaluronic acid. The entry point, it was in the orbital superior crest. So I avoid the arteries, the main arteries in this area, and I was fanning in all direction, going from lateral to medial. طبعا this video, it is fast. We did it fast. لا تتفاجئوا, don't be shocked. I'm not that fast, okay? But I wanted to make it faster for you to save your time. So I did it from, if you see, it is not well spread. After that, I went from the other side and then I did a slat massage, okay? And I was injecting superficially. This is one of the ways of injecting. The other ways of injecting was deep microboluses in the bone itself. So let's go. Let's proceed, Dr. Muhammad.
حاضر دكتورة. Next slide
Okay.
also.
Yeah, next slide. We saw this one, the next.
Next also.
Yeah, next. This is for the same patient.
Next.
Next. Yes.
Yes.
When we see this patient, there is depression here in the mid of the forehead, and then we fix it by only 1 cc of hyaluronic acid. Now, let's move to the temple area, which I considered very important, especially that nowadays we see a lot of people are doing exercise, losing weight. So one of the area that it is affected hugely, it is the temporal area. And I think when we lose the hollowness of the temporal area, it will give us more tired look. It will increase the shadow in the lateral part of the forehead. It will give us like narrowing of the eyebrows. It will decrease, or it will lower the lateral part of the eyebrows, so it will not look fresh and pulled upward. So let's look for the anatomy of the temporal area. Superiorly, we have the temporal line, and medially, we have the orbital ridge, the bony orbital ridge. We can notice it by touching it. And then laterally, we have the eyebrows, and inferiorly, we have the zygomatic arch. Okay, let's go next. In this area, next slide, please. In this area, we have 10 layers specific for this area. And there are only 2 layers which are safe to inject. Okay, layer number 9 over the bone, and in the temporoparietal fascia, which is the 3rd layer when we inject by the cannula. Okay, as the forehead, also we can use microdroplet by needle, or we can inject by the cannula superficially. Let's go to the next slide. In one of the study, they describe the hollowness of the temporal area like a lake, okay, comparing the lake with the ground area around it. When we inject filler, when we want to remove the hollowness of this area and convert it from convex into concave, we shouldn't exceed the bony marks around it. Otherwise, it will be exaggerated and it will not give us the aesthetic look we are looking for. Let's look for the next slide. Okay, can we press double click in this slide, please? We can see this lady, okay, from a very hollow temple into a well-developed temporal area. Okay, we can describe it like a lake when we fill the water. We shouldn't fill the water above this level. Some people overfill it, and it will not give us a static look, and it will keep moving when we chew, because the masseter muscle will keep moving, okay, and it will look weird. So we shouldn't overfill this area. Next slide, please. Okay, the important structure here, it is the superficial temporal artery. Okay, it is in the 4th layer in this area. That's why when we inject, I will show you exactly how to inject to avoid injecting this artery, which is very important because there is a direct contact between this artery and the ophthalmic artery. Next slide, please. Okay, when we inject the hyaluronic acid, it should be between the mid and the high density. If we are going to inject superficially, we should use the cannula and we should use the mid density cross-linked hyaluronic acid. While if we are going to inject deep, we can use mid and high density cross-linked hyaluronic acid with a deep micro boluses by needle. And as I told you, we can inject in 2 levels, either in the temporoparietal fascia or deep to the bone. Okay, let's move to the next slide. We should be very gentle while injecting this area, because if we apply too much pressure, we can penetrate the bony structure and go inside to the brain, and this is very dangerous. There is a study shows that if we apply more than 4 kilograms pressure by the syringe in this area, we can penetrate a very thin temporal parietal bone in this area. And there is one case study had been suffering from this complication. Next, please. Next.
Next slide.
Next, please.
Okay.
Let's see this lady, this beautiful lady. She's one of my friends. She have depressed temporal areas. She did fillers somewhere, and then I saw her. When I saw her, I told her everything is beautiful and nice except the temporal area. You should do it to reharmonize the beauty of your face. Let's go to the next slide to see the video. Yes, here. Yeah, I'm marking my areas. I'm using here the deep bolus. Okay, I have to aspirate. And this technique, we call it the gunshot technique, because it is inside going, directing the syringe to the brain. So we have to be very gentle, okay, in order not to apply too much pressure. And we have to aspirate, and we have to touch the bone. We have to be over the bone. Okay, some people suffer from headache after the injection. It can last for 1 week. This is normal. We have to reassure them. Sometimes when we inject this area, it can lead to congestion of the veins in this area. This is normal. We have to reassure them. It will stay for a couple of days, and then it will fade by itself after the filler have been spreading and take its own space. Next slide, please. Yes, we can see here before and after. We can see how her face look more in harmony and how it look more comfortable because there is like sympathy between the first and the upper and the second, which is the mid, and the last part, the lower part of the face.
Amazing. Sorry, how many ml did you use on both sides?
Usually, I think in this patient, I have been using 1 cc in each side, but sometimes I go up to 2 cc in each side. This is the maximum I can inject in 1 sitting. Sometimes I can add.
أنا أعتقد هذه دكتورة يعني this is the most important message you always emphasize in your training courses and when to everyone that you have been lecturing. It's not about the amount of filler or the quality of filler. It's more about operative dependent. If you do things properly in the right way, in the right technique, you end up having such an amazing results. So ما شاء الله الفرق يعني كبير جدا.
Thank you.
Next slide.
Let's move to the next slide. It doesn't show that much in the picture, but in real, she was very happy after we did this slide because it really make her look younger and more fresh. She can pull like the frontal hairline backward. She shouldn't cover this area. A lot of people are shy to show this area, the temporal area, after they see it depressed, because it makes them look unfresh or older than how they seem. But when we inject it, they feel very happy to pull their hair backward. Okay, let's go to the next slide, please. Now we are talking about the eyebrows. This procedure is very helpful for people who are really going old age and have remodeling of the bone in this area, because after the atrophy of the the fat in this area, which is the roof in this area, or the SOOF, we can say it. Okay, it will be flat. And with the bony remodeling, it will help to depress this area, and it will not have the very nice protrusion anteriorly of the eyebrows. So let's see the next slide, please. We are talking about the roof in this area, which is the important fatty structure that we have to fill the filler above it. And we have to imitate that we are increasing the amount of the fat of this area to give it the anterior protrusion. Next slide, please. Okay, as we say, we are going to use cross-linked mid to high potency density hyaluronic acid, and we can use micro droplets, boluses, or superficial antegrade fanning. This is one of the not common antegrade fanning. Usually we do retrograde fanning, but here we will go antegrade fanning because we want to be very safe with the artery structure moving in this area. So the more we are proceeding anteriorly, we will inject. And usually I have to inject with, I like to inject with the cannula in this area, in the subcutaneous layer. So can we see the next slide? Can we double click, please? This is my entry point. It will be lateral. And then I'm injecting. I'm trying to be anti-grade, not retrograde, in order not to hit any of the important arteries, either the supratrochlear or supraorbital artery. Supraorbital, طبعا, it is very far, it is medial, but the supratrochlear artery. Okay, usually I don't need to inject more than half cc. Sometimes I can inject more, but I prefer to inject it in the next setting because I want to avoid, I don't want it to become swollen, because if I inject too much product, it will collect water and the area will become swollen, and the patient will not be happy with the result. It will take time that the swelling will fade and it will show the result. So we can divide it into sessions, better than going in one setting and the recovery period will be longer. We can see here, maybe it doesn't appear the result from anteriorly, it should be like from the side, how we protrude little bit the eyebrows anteriorly. Let's see the next slide. Okay, we can see here how only by the fillers we had raised the eyebrows and give it fresher look and anterior projection. And that's it. So in conclusion, the upper part of the face is one of the areas has been neglected, although it's very important because it can affect the beauty of the face dramatically. And there are some important and safe ways to inject the filler in this area in order to go one level higher in our plan to beautify our patients. And thank you very much for listening. I hope it is very important. I didn't want to go too detailed and too deep with you because today is the 4th day of Eid, and I'm happy to be with you in this webinar, and thank you for the invitation, and inshallah we see you in another webinar with Dr. Muhammad. Thank you very much.
يعطيك العافية دكتورة. طبعا we will have a couple of questions لو وقتك يسمح، بس أعطيني فاصل. We'll be just on 20 seconds break and we'll be back to questions.
Sure.
اوكي يلا 3 2 1 we'll be on live. احنا لايف. طيب يعطيكم الف عافيه، شكرا جزيلا على وجودكم معنا. دكتوره الاء اعطتنا presentations رائعه و I don't want anyone to feel upset or sad. This is the beginning. We'll have multiple series inshallah مع الدكتوره الاء and she's always been I personally can tell you always been a big motivator and a big supporter for everyone to learn. And now I will take a couple of your questions and carry it on to Dr. Ala. There is a question, Doctora, about people are asking about the advice of traveling after having a Botox or filler intervention.
Usually there is no fear. Okay, as long as the procedure is safe, it happened in a nice way, and you are happy with the result. The only thing after traveling, if we are going in a plane, the only problem can happen in case if we have a bruise that in the plane, because of the pressure, it can take longer time to fade. This is the only thing. Usually I assure them, because I have some patients from different parts of Saudi Arabia, from different cities. So I tell them no worries, as long as you're happy with the result and you are only going by plane and there is no bruise, inshallah nothing will happen. But the only thing that if there is bruise, it will take longer time to fade. This is the only thing.
Jamil. We have one more question here. How did you lift the eyebrows in the final pic? أعتقد هاي سر الصنعة يعني.
How did you lift the eyebrows?
Yes, in the final picture.
Okay, let me tell you. Usually when I inject the eyebrows, okay, I don't go medial. Usually, I didn't explain it. I forgot to explain it. When I inject, I have to go only to the mid-papillary line, to the level of the mid-papillary line, okay, and then I inject there, and then I inject the lateral part. I inject little, and then slowly, I increase the amount. The maximum amount I injected, it is in the most lateral part of the eyebrows to lift it upwards. And sometimes there is another trick. We can inject in the upper part of the eyebrows, little filler. It will also increase in lifting the eyebrows. Another thing, only by filling the temporal area, we can also raise the eyebrows. So this is one of the important points if we want to consider raising the eyebrows after using Botox and it didn't give result. We can inject in these three areas. We can inject in the eyebrows itself, the lateral part, above the eyebrows, and in the temporal area.
جميل دكتورة، يعطيك ألف عافية. أعتقد this is enough for today. We had over than 300 viewers and we had a lot of questions. أعتقد كان واحدة من أجمل وأخف topics, yet it was a complicated topic, but you made it very simple. Thank you so much. And hopefully we'll have you over again. Have a good evening, you and everyone who's been watching us, and I'll flip the floor for you if you want to say anything.
Thank you for the invitation. Happy Eid for everybody. And some people are very hesitant to inject this area. I think by practice and following the safe guidelines for the injecting the right material, we can do it, and it will give amazing results for your patients. I encourage you to try it for your patient if they need it. They will love you, because a lot of people, especially for the temporal area, they've been very unsure to inject it, but after convincing them, they have been injecting it, and they keep returning back to me to keep filling it after it have been fading. And that's all. Thank you for following, and inshallah we'll see you again.
يعطيك ألف عافية دكتورة، ونشوفكم على خير.
that takes you higher. I will forever be intertwined with you. Where the sun never goes down and time has slowed down. Would it be too crazy if we decided to stay forever? Decided to stay forever, forever. Stay forever. Stay, stay. Stay forever. Stay, stay. Stay forever. Stay, stay. Stay forever. Stay forever. Jump into the fire. I'd like to see your wild side. We should run away where the sun never goes down and time has slowed down. Would it be too crazy if we decided to stay forever? Decided to stay forever, forever. Stay forever. Stay, stay. Stay forever. Stay, stay. Stay forever. Stay, stay. Stay forever. Stay forever.
Baby, all I need one more chance. Oh, baby, let me show you. I need one more chance. Oh, baby, all I need one more chance. Oh, baby, let me show you. I need one more chance. Oh. All I need.
Look at those palm trees dance.
You gotta put your past behind you. Look, kid. Bad things happen, and you can't do anything about it, right?
Right.
Wrong! When the world turns its back on you, you turn your back on the world.
Well, that's not what I was told.
Then maybe you need a new lesson. Repeat after me. Hakuna Matata.
Hakuna Matata. It means no worries.
Repeat after me. Hakuna Matata.
Hakuna Matata. It means no worries.